Hi everyone, welcome back to my channel. This is Dr. Nakubiana Mufaya Siameka, or you can just call me Dr. Mufaya. We're going to talk about the complications of diabetes. There are many complications, but I will stick to the most common ones, and hopefully I'll talk about how to prevent those complications and how you can go about managing the complications if you have them. So the major complications of diabetes are diabetic ketoacidosis, also known as DKA, and hyperosmolar hyperglycemic state, HHS. DKA usually affects type 1 diabetic patients, and HHS affects type 2 diabetic patients. So they are quite similar in presentation, but the mechanism of how they come about usually differs. For both of these type 1 and type 2 DKA and HHS, they would have reduced amount of insulin, increased amount of glucose, and the difference is that in type 1 they would have ketones in the urine together with the glucose in the urine, while in type 2 they might not have ketones in the urine, but they might have glucose in the urine. So that's why it's known as diabetic ketoacidosis, because there are ketones being produced from the breakdown of fat. So usually treatment for this type of a complication where your glucose is really high, to bring down your glucose, of course they'll give you insulin in that time period when your glucose is really high. They will be giving you insulin until your blood glucose drops or goes down. That's when they might decide to give you tablets if you're a type 2 diabetic patient. If you have an infection, they might be able to give you antibiotics. Apart from your insulin and your antibiotics, they will need to give you lots and lots of fluids, because as your glucose is going high and you are urinating the glucose, your kidneys are excreting that glucose. They are also excreting water, so it tends to reduce the amount of water that is there in your system. So you become very dehydrated. So they'll give you fluids to be able to supplement the amount of fluids that you're losing from your body, as well as of course give you insulin, antibiotics, and other medications or other drugs that might be able to assist you to become better. So how do you know that you are having DKA? Usually you'd have the typical symptoms of diabetes: polyuria, polydipsia, polyphagia. If you don't know what that is, go back to my previous video. If you are having those symptoms, maybe you are having high fever, feeling drowsy, feeling fatigued, you might even start having low consciousness, reduced level of consciousness. So if you notice somebody who is just lying down, maybe they don't have energy, and yeah, they look drowsy, rush them to the hospital, especially if they are diabetic, because you might never know, maybe their sugar is really high and they need medical attention as soon as possible. Those are acute complications, but diabetes also comes with long-term complications. So it affects your eyes, it affects your kidneys, it affects your heart, it affects your nerves. So for the long-term complications of diabetes, they are grouped into two. That's microvascular and macrovascular. Micro and micro. So for the macrovascular complications, patients who are diabetic are more prone to have cardiac artery disease, stroke, and also peripheral artery disease. So to prevent these macrovascular complications, so actually before I talk about the prevention, patients who are diabetic are about 3 to 5 times more likely to have a cardiac a heart attack, and also about 2.5 times more likely to have a stroke. So if you are diabetic, you will really need to follow up with your physicians in the hospital to make sure that you reduce the risk of all these complications. So the major things that you have to do to prevent yourself from getting these extreme complications would be one, of course, your blood glucose has to be controlled. So your sugars have to be controlled very, very well. And two, your blood pressure has to be controlled. Three, the amount of fat in your body has to be controlled. So either through diet, and also they might give you some medications that will help you to reduce the amount of fats that are in your body. Smoking, if you're a smoker, stop smoking to reduce your risk of having stroke and heart disease. Then the other thing is of course exercise to help you reduce weight. Then for the microvascular complications, your eyes are number one on the list, your kidneys and your nerves. So you have to protect all of them. For your eyes, make sure you see your optometrist or ophthalmologist at least once every year to get your eyes checked to reduce retinopathy. And for your kidneys, control your blood pressure, take your blood pressure medication. You might be diabetic and maybe also on blood pressure medication. Make sure you take your blood pressure medication and have your blood pressure checked at the hospital on a regular basis to know how much your blood pressure is, and also to know what dose of drugs to give you to bring your blood pressure to a certain range that is acceptable or recommended for patients with diabetes. Then for patients that have retinopathy, make sure you don't wear tight shoes to prevent having soles, because if you have retinopathy and you can't feel your toes, or you have reduced sensation in your limbs, you might end up hurting yourself. Or if you get a sore, a wound in your limb which has reduced sensation, you might not be able, the doctors might not be able to treat it very well, and you might end up having to cut off that limb if the wound becomes really, really big and becomes septic, such that it's not controlled by medication. So take care of your limbs. Wear comfortable shoes, don't wear too tight shoes, and avoid walking around without shoes. So that's it for the complications. If you have any questions, please do ask me. You can send me a message on Facebook or Instagram. It's Dr. Nakubiana Mufaya Siameka on Facebook, and on Instagram is Dr. Nakubiana. So send me a message, or you can comment down in the comment section and let me know what questions you might have, or what else you would like me to talk about. So that's the end of the video. I really hope you have enjoyed it, and I'll see you next time. For now, it's bye.